Hello, I am Rachel Krug. I am the CEO of Virtual Field. Virtual Field is an exceptional eye exam experience with visual fields, color vision, and pupillometry exams in this portable, patient-friendly headset. I am joined today by Dr. Stephen Rosenfeld. Welcome, Dr. Rosenfeld. Could you kindly introduce yourself, please?
Sure. I'm happy to be part of this webinar, Rachel. I'm Dr. Stephen Rosenfeld. I am a practicing ophthalmologist with the Delray Eye Associates in Delray Beach, Florida. I am the president and managing partner of our 9-person practice and have been using the virtual field machine for over a year now in my practice.
That's awesome. Can you tell us a little bit more about how you're using virtual fields at Delray Beach Eye?
Well, yes, the Delray Eye Associates, we're a 9-person multi-specialty group. So we have a neuro-ophthalmologist, pediatric ophthalmologist, 2 glaucoma specialists, 2 cornea specialists, a retina specialist, and 2 oculoplastic specialists. So we have many different people that have needs to do visual fields.
Mhm.
And the oculoplastic specialists, as you know, do visual fields to get Medicare approval to do blepharoplasty surgery. The neuro-ophthalmologist, certainly just about everything relates to the brain and the optic nerve. So there's a justification for doing visual field testing. And certainly the 2 glaucoma specialists, you know, that's the gold standard of following glaucoma. But even for a cornea cataract specialist like myself and one of my other partners, there's still plenty of opportunity to use the machine. And we all follow patients that have glaucoma. That's very important.
Mhm.
And it's a much easier test to administer. It's a test that's faster than the traditional Humphrey visual field machine. It's more comfortable for the patient. They're not hunched over on a chair, resting their chin on a very uncomfortable chin rest.
Right.
The test is a little quicker. It's easier for a technician to administer. And in fact, I even have my scribe, who's not even trained at the level of an ophthalmic technician or a visual field technician, to administer the test. It can be done in an exam chair and not in a traditional room. And the printout is very easy to understand, to decipher, and is very similar to the traditional, Humphrey visual field printout that we get.
Mhm, mhm. That's great, and I'm pleased to hear that your patients are having a good experience with virtual fields. Could you shed a little bit more light on that, on the specific patient experience?
Well, some of it is as simple as it's very easy to add on patients. And in fact, that was the way we've started integrating the virtual field device into our practice, is that somebody comes in and they weren't scheduled, or there was a snafu in scheduling, and they have glaucoma, they need a field. It's easy to add one on.
Mhm.
I've had patients come in that say, oh, by the way, 3 months ago, my rheumatologist put me on Plaquenil, and this is my annual exam.
Mhm.
And he said you would know what to do. And they never called in advance, so we could arrange an OCT or a visual field test. So it's easy to add that on. And again, clinically, that's important. You don't want to necessarily miss something. And it's important to get a baseline
Right,
once they're started on a drug like that.
right.
We've had patients come in where they're complaining of a visual field defect. It could be as simple, and for those of us that are doing cataract surgery, there's an entity called negative dysphotopsias, where
Mhm.
patients come in after cataract surgery complaining of seeing a visual field defect, an arc-like visual field defect in their temporal visual field.
Mhm.
And you think that that's what it is clinically, but it's very easy to say, look, I'm going to dilate your eye, and at the same time, we're going to use the virtual field device and get a quick visual field to make sure there isn't a subtle retinal detachment or some other neurologic disease. And it's not making a patient that's a busy post-op patient come back for an extra visit. Um, so those are just some examples where you can accommodate a patient quickly. For
Sure.
some patients, when you're dealing with the geriatric population, coming to a doctor's office is a big ordeal, arranging transportation. And if you're a busy doctor, finding another opening in a reasonable period of time. So it's very easy to be able to get fields really at the drop of a hat.
Right, that's great. Since adopting virtual field, has the portability of the headset made an impact on your patient workflow? So again, this is the virtual field. You can see it's very light, very easy to carry around, extremely portable.
Well, it's nice because the patient, again, doesn't have to go into a traditional visual field room, sitting
Mhm.
on an uncomfortable chair or a stool that may move, and having to be hunched over, taking the test. And so we can give the test, therefore, with a patient sitting in an exam chair. They can even be sitting in a quiet part of a lobby or any other room, where there may be just a comfortable chair and it's reasonably quiet, and you can get their attention. So
Yes.
it does make it very easy. And there are patients who are wheelchair bound or patients who've had cervical neck surgery, and it's really very uncomfortable for them to take the test. And if
Right.
they can sit still hunched over, even in a wheelchair,
Right.
it's on their head and it's appropriately oriented because it's attached to their head, and you're able to get reliable fields that way.
That's great. And how have your technicians used virtual field?
Well, it's nice because the technicians understand how to use it, but a technician can get a patient started with that, and they can walk out of the room or walk away from the patient. It doesn't require quite as much uh, observation by a visual field tech when you do the tests. And in fact, one of the things that's very nice about the virtual field machine, different than some of our competition, certainly better than a more traditional Humphrey visual field machine, is that there's a wonderful visual explanation and education for the patient about what the visual field is, what they need to press, how they need to participate in the exam process. And I can tell you that, human nature being what it is, we have many visual field techs who don't spend the time
Right.
explaining to the patient. And even if the patient is not their first field, they need to be reminded time and time again. So having a codified, consistent, reliable patient education process that takes all of about 2 minutes with the headset on is
Right.
very effective. And I think it improves the accuracy and reliability of the testing.
Thank you. We've heard great feedback on those instructions before the test begins, and also the virtual field does read corrections if the patient's eyes start to wander, and encouragements in the process. So appreciate your insights on that. Has your practice seen an economic impact since adopting virtual fields? What would you say the ROI is, and can you shed some light on that impact?
I'm not sure I'm not qualified, but I don't really have available to me, readily accessible, the what the ROI is in dollars and cents or in true percentage increase. But I can tell you that there's, probably me alone, there may be 3 to 5 visual fields a week that I'm able to add on that are not, and I'm a cornea cataract person, so I'm not seeing the volume of patients that may need visual field testing compared to my neuro-ophthalmology partner or my 2 glaucoma partners. But those patients per week, and it's also a field test that's done in a shorter period of time. So the efficiency allows a technician or a visual field tech to administer more visual fields per unit time than a more traditional visual field machine.
Mhm.
And the fact that my technician, who's very well trained, can start a patient off on the test, go out and even work up another patient at the same time, then you're really getting two for the price of one. So there's on many levels, many ramifications of the increased efficiencies and revenue production, but I can't really give you specific numbers at this time.
No, no worries. Thanks for the high level impact on the increase in patient throughput. That's a really important component of the ROI. And what else has been an impact on your practice? What's the biggest impact since adopting virtual field?
Well, I would say part of it is that patient acceptance is greater. Patients are far more comfortable taking a virtual field, having a virtual reality device on their head, and not having to sit in an uncomfortable position for up to 20 minutes taking a test.
Mhm.
And so it's patient acceptance has been greater.
Right.
Getting the results back more quickly, relatively speaking, is greater.
Mhm.
Being able to get a test on a day when we're already fully booked on the traditional visual field machine is immensely better accepted by patients, and improves revenue because the patients are there, you're getting the test,
Right.
and it even makes your clinical um, workup of the patient more efficient because now you're getting the data that you need right away, and not having somebody have to come back weeks later before you can tell them whether they may have glaucoma or some optic nerve disease or what have you. Um, and the acceptance is the other improvement, I think, would just be in terms of revenue,
Mhm.
that being able to just get the extra tests that, I'm not at a point where I'm doing exclusively virtual field tests, so I can't tell you that compared side by side for a full day of one versus the other, but just being able to capture, if you can capture 5 visual field tests, let's say a week,
Right.
and that revenue that would have been out the door, and patients don't always show back return for the
Right.
test we'd like them to take, that's gravy. That's pure gravy.
Right. Amazing. Is there anything else you would like to add, Dr. Rosenfeld?
Well, I think that the virtual field company was also very helpful in getting our technicians oriented to using the machine, as
Okay.
well as getting me oriented to using the machine. And as you might imagine, sometimes as physicians, we don't experience a lot of our own imaging devices ourselves. But
Right.
not only did I have, the benefit, and it's all done remotely, which is great. You don't have to have somebody physically present. But I had them spend time with me to get my virtual field device hooked up
Yep.
to the internet, to the cloud, which was very easy, but people were available. They were able to orient me on how to use the device. I took the test myself, which also is very instructive
Yes.
because I bet most visual field techs have not sat and taken a traditional Humphrey visual field or even had an OCT of their retina or optic nerve performed on them. And
Right.
it humbles you a little bit, but gives you a better appreciation of what the patient's going through. But all this can be done virtually. They're available, throughout business hours, 5 days a week. And so it's very easy if a technician has 15 minutes or a half-hour break that they can be communicating with the virtual field company and getting oriented. So they've been, it's very progressive and very helpful.
That's great to hear. We do take pride in having a dedicated team of customer success managers to onboard and build relationships with their customers. They're based in the United States and they are former ophthalmic technicians. So I'm glad to hear you had a great experience with onboarding, and also great that you're continuing the relationship with Virtual Field. We appreciate having you as a customer.
Well, thank you. And the last thing I would just say is that if you think of a practice where 9 people, you think of some larger practices or practices that may be part of corporately owned ophthalmic platforms, that if you start having if you have a virtual field device or multiple devices in an office and you figure out how much time is saved, how much revenue is generated, you're really talking about very large numbers when it's all said and done.
Completely. Awesome. Well, thank you so much for your time.
Oh, thank you. I appreciate it.